All right, we are going to talk about a second option for innominate abduction, okay? Or I guess you could say a third option. But again, let's review what needs to happen for the innominate to go into abduction. All right, so the hip is abducting. So this is the same motion as hip abduction. All right, so the iliac crest needs to move medially. The PSIS needs to compress on the sacrum, and the ischial tuberosity needs to move laterally, just like the hip is moving laterally. Okay, so our manual contact is going to be creating a creating basically a coupled motion with a manual contact on iliac crest and a manual contact on ischial tuberosity. So let me show you how to do this. The other thing I want to say about this is the other manual contacts in sideline are with the hip in a neutral extension position. This is with the hip in a flexed position. Okay, so the lack of innominate abduction may show up differently in neutral extension versus a hip flex position. That's just kind of an FYI. You might want to check both of them. All right, so we're going to bring her opposite leg up. We want her to help us to lock out the right side of the pelvis, okay? So she's going to bring her right hand on the outside of her tibia, hooking onto the inside, pulling her leg into a little bit of internal rotation. She's just going to assist that abduction with her left hand, okay? So she's going to kind of come into that position, all right? I am going to mimic that exact same position on the right side. This is a technique that you'll want to get consent because you're hooking onto the inside of the client's ischial tuberosity. So is that okay with you? All right, so in order to do that, I am going to use my chest to help keep her leg localized. One manual contact is going to come on her iliac crest from the side. The other manual contact is going to come forearm on the inside of her foot so I can take her into internal rotation. The other hand manual contact here is going to come just inside of ischial tuberosity. And now I'm going to localize her into abduction, okay, creating that coupled force. Right hand iliac crest, left hand ischial tuberosity. Now from here, I can have her pull in with her foot, and that engages both of my hands. And let it go. And then I just need to relocalize. The therapist position is really important on this because you've really got to kind of control what's happening through your chest. Okay, there we go. That okay? Mm-hmm. All right, now pull in with your foot and let it go. And you just have to check and make sure with this that knees feel okay, that they're comfortable with your manual contact, and then you're just continuing to do functional mobilizations until you get either a springiness to the infill or no more improvement. Okay, so this is looking at innominate abduction in supine position with a bias of hip flexion.